Hello, my name is Bridget Cord, and I am a nursing student at Indiana State University, currently doing their LPN to BSN bridge. And this is an educational module. It is created for perinatal women currently receiving Medicaid in Pierce County. Breast, is it really best? A closer look at breastfeeding. Let's take a look. The learning objectives today are to understand the nutritional and immune building value of breast milk for baby and mother, understand how breastfeeding promotes mother-baby bonding, understand what the current recommendations for breastfeeding are, understand what a good latch is and different positions for breastfeeding, provide resources in our community to help breastfeeding issues and questions. I have provided here a pre-test quiz to test your knowledge. Take a moment if you would like and go over these questions and write down your answers. At the end, we will take the test again and I will provide you with the answers. So what are the recommendations for breastfeeding? So the APA, or the American Pediatrics Association, or the AAP, the American Association of Pediatrics, recommends that breast milk be exclusive for the first 6 months of life. After 6 months, begin introducing solids by still breastfeeding till the first year. And then after the first year, you can continue as desired. As long as you and baby want to breastfeed, that's just fine. So what's so great about breast milk? Nutrients, immunity, and bonding. Breast milk has the perfect combination of proteins, fats, vitamins, and carbohydrates. There's nothing better for the health of your baby. Also, breast milk contains leukocytes, and these are living cells that are only found in breast milk. They help fight infection. It is the antibodies, living cells, enzymes, and hormones that make breast milk ideal. These simply cannot be added to formula. Also, when we breastfeed, this allows baby and mom to bond. It's skin-to-skin time, usually in a quiet environment where you can gaze deeply into each other's eyes, and this creates a wonderful bond between mother and baby. But how is it good for me, you might ask yourself? Well, for one, breastfeeding burns calories. An extra 500 calories a day is what the estimate is, so it helps our bodies to return to our pre-pregnancy form. Also, it reduces uterine bleeding after birth. When we breastfeed, it helps our body to release a hormone in which not only does this oxytocin that's released help us bond with baby, but it also helps our uterus to contract back to its pre-pregnancy size. It lowers your risk for breast, ovarian, and endometrial cancer. It reduces your risk of type 2 diabetes. There's lots of studies towards this one. They're not exactly sure how it works, but something to do with our pancreas and the cells and hormones that are released from our pancreas during breastfeeding. It helps to have a long-term effect of reducing our risk for diabetes. It lowers our risk for heart disease, and it's low cost and easy access. You can breastfeed anywhere and it doesn't cost any money. But most of all, and one of the best benefits, is it increases bonding with baby. So, formula versus breast milk. Let's just take a quick look. Formula is not as efficiently utilized and absorbed as breast milk in the baby's tummy, whereas breast milk is a perfect balance of nutrients and is easily digested and absorbed. With formula, some babies have difficulty tolerating certain nutrients, and it can take many tries with many different formulas before you can find the perfect one for your baby. Whereas mother's breast milk is easily digested. Also, breast milk does not forgive me, formula does not have immunoglobulins, whereas mother's milk contains immunoglobulins, providing that passive immunity to baby. A formula is expensive, breast milk is free, and also a formula is not readily available and will have to be prepared, whereas breast milk is always available warm and ready to go. So how can you make this work? To start, knowing some good positions is always helpful. So here I have listed a few. Cradle, which is our traditional baby in arms. Crisscross cradle, underarm, or also known as the football hold, sideline, and lying back. Below, I have provided a link which can help you actually see. There's a short video provided us by Baby Center, which actually will show you these different breastfeeding positions that I have just pointed out. But most important, latch is where it's at. Here are some tips on good latch. Make sure you hold the baby close, chin first, and nipple to nose. Make sure baby's mouth is wide open, tongue forward and down. Once baby has latched on, make sure nose is clear. Also, you shouldn't be able to see your areola, and all of the nipple should be inside. The most important thing is if this doesn't feel right, release the latch and start again. Below here, I've also provided another short video that you can watch from Baby Center, which will show you exactly how to do a great latch. So, you need to go back to work, and that's okay. Many moms work and breastfeed. This is okay because you can feed the baby right before you go to work and right after you get home. You can utilize a breast pump, which most insurances actually will pay for a breast pump. You just have to ask your pediatrician to write you a prescription. It enables others to help feed baby, and you can store your breast milk in the refrigerator or freezer. So this is great, and actually breast milk can be stored in the fridge for 3 days and is good for 4 to 6 hours after pumping without being stored in the fridge. Here are some common problems that we worry about. How do you know if my baby is getting enough? This is probably the most common thing, and do I have enough milk? So there are some indicators that we can look for. One, if baby is having 6 to 8 wet diapers a day, that's a really good sign. Also, when you take your baby to the pediatrician, they're going to weigh baby, and this is going to be another really good indicator that your baby is getting enough. Also, baby is less likely to be fussy and crying. Some people have too much milk. That's a wonderful way to manage that is to pump and store, so that can help. And then after a couple days and the real milk comes in, some women have issues with engorgement. The best thing for engorgement is just to breastfeed through it. Sometimes you can take a nice warm shower and sort of kind of milk your breast yourself manually with your hands to release some of that engorgement. One of the big things that we hear a lot about and really want to watch for is breast infection or mastitis. And some of the signs of this would be super tenderness, hot, red breast, and running a fever. You can breastfeed through this, but it's pretty important that you actually call your OB and get in to see them because they'll usually prescribe you an antibiotic for mastitis. But no worries because this is something that you can work through. Another issue, inverted flat or large nipples. So you can still breastfeed with these issues, and so this is when we recommend that you talk to a lactation consultant, and they can help you get through these issues with nipple issues. And I've provided those resources for you at the end of this slideshow. Some other issues are slow or rapid milk letdown, so sometimes it's hard for women to let the milk down, or sometimes it happens too fast. So these are some issues that you can also go over with a lactation consultant. Sore, chapped nipples, and painful breast. Well, the biggest reason for this is quite simply a latch. So it always comes back to that latch. So really take some time to get to know your latch. Here are some resources online. Here are some local Pierce County resources. Here's that post test we talked about. I've also included the answers right here. And here are my resources. Thank you.